everyone, this is Elisa from NohProblem Consulting Agency. Today I wanted to go over the healthcare assistant position. Some may get confused it with caregiver. The easiest way to differentiate those two job position is, first of all, they have a different knock code. So this is what you will see on when you're typing healthcare aid, nurse aid, all this aid, literally the assistant role. And then you can see that the knock code is indicated as a 33102. Whereas if you do look for the caregiver position, okay, so for the caregiver position, this is a home support worker, caregivers, and related occupations. So they are under a different knock code here, and then employer requirements are right there. But when you look into the employer requirements for these two, you don't see that much of differentiation between those two, because it requires secondary school education and then on the job training or personal support worker, nursing aid, healthcare aid, college or private institutional program or college nursing orderly program and supervised practical training are required. So basically, it's either some secondary school education or the private institutional college or just regular college programs are required in order for you to be eligible for working as 33102 for the healthcare aid. So I need to make sure that what that means. So the thing about this new tier group is that last year, just before they introducing this new knock code number, healthcare aid were fall under the knock C or D, so it wasn't included in knock B. But the biggest change here is they have upgraded these healthcare aid position into the tier 3 group. That means they are eligible for express entry now, because now this is basically what it used to be not B position. So for the healthcare aid program, there were no other way but to apply for the PMP program from the past. But after this new introduction of changing those tier into the rightful tier where you can apply for the express entry, this is a huge advantage for the healthcare aid or healthcare assistant. So that because of that, there has been lots of inquiries and leads and interest in going to the healthcare aid program. And as you can see, those programs are kind of required to become a healthcare aid. Okay, so this is for the express entry possible position healthcare aid program. And then I highly recommend that you should go to school, join the school for this particular position. For caregiver, we don't see that much of a requirement in terms of educational, but it does say something about college, other courses, training program in care of the elderly. So I honestly, when I'm looking at this, I don't see there are huge difference between these two. But if I have to make a comment on those requirements, obviously caregiver is a lower tier. That means it requires a less of educational credential or experience whatsoever. So what people normally do nowadays is they do enroll themselves into this healthcare aid program, and then when they graduate, they got two options. One, they will be hired as healthcare aid in corporation as a company staff. Okay, so in that case, your job position will be healthcare aid, and then your position will be tier 3. That will make you eligible to apply for your express entry. So that's one of two options. And the other option would be you are finding a caregiver supporter, i.e., your caregiver owner. So when I say caregiver owner, that's not really the right way of saying it. So caregiver employer. So employer for the caregiver position has to be individual. You cannot become a caregiver and then applying for your caregiver position. Applying for your caregiver position as a company employee, it needs to be one-on-one individual contract that you made with your individual employer. So those are the two big differentiation. And then depending on where you're going to be landing on, you can choose whether you wanted to go for the express entry or you have to apply for your caregiver program, like in-home caregiver program. So to make a long story short, regardless which pathway you're going to take in terms of healthcare worker, it's really hard for you to get a job for either a position without any credential. So basically, these type of job, you're dealing with patient, or you're dealing with some people who requires a medical care. So if you put yourself into your employer's shoes, would you hire someone who doesn't have any experience in Canada, who doesn't even have a license, or who doesn't even have education in caring patient, to come over to Canada by supporting them or sponsoring them, not knowing that what that person can or is capable of doing? So that is why normally health aid worker go with the actual courses and programs that is offered in Canada, and during that program they go through the internship, practicum. They do need to get their practicum hours. So that's when they normally get approached by either company or the actual individual patient, or the other way. Or you can just submit your portfolio or your resume direct, finding those company who does help you with matching or recruitment services. So those are the things that you need to consider when you are thinking about either immigrating to Canada for 44101 and then 33102. In my personal opinion, finding a caregiver sponsor is not that easy without working for them to start with, and then also it's because it's highly appreciated that employer obviously wants someone who has some kind of credential to look after the patient. So that's why I think it's very, very important for you to have a little bit of education in related to this to become or to be eligible for applying for the permanent residency under these NOC tier code. So now the question is, where can I go to learn these programs? And there are numerous different options, but most easiest way to go through that is just going through the private schools. I do have a lot of list of the private school in each provinces. So if you do need my help to decide which school you should go to, how you are going to get your study permit, just feel free to come by www.nohproblem.com, and I could walk you through how and why it is better for you to study. Some people couldn't even apply for the study permit, but that will be all depending on your conditions. So yes, please feel free to get in connect with No Problem Consulting, and I'll try and help you out with immigrating to Canada in the near future. Okay, thank you for watching my channel, and please don't forget to subscribe and then like my video, and I'll see you on the next video. Bye bye.